Welcome everyone to today's webinar, Chatbots versus Conversational AI. What's the difference? On behalf of Becker's Healthcare, welcome and thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log in to today's webinar to access the recording. If at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. At this time, it is my pleasure to introduce today's presenters. Dr. Aaron Neinstein is the Chief Medical Officer at Notable, and Tom Alterman is the Head of Product at Notable. Dr. Neinstein and Tom, thank you so much for joining us today. I will now turn the floor over to you.
Thank you so much, Molly. It's great to be here. And hi, everyone. My name's Aaron Neinstein. As Molly mentioned, I'm Chief Medical Officer at Notable. Before this role, I spent more than a decade in digital health and clinical informatics at UC San Francisco, and most recently was Vice President of Digital Health at UCSF. I'm also a practicing endocrinologist.
Hi, everyone. My name's Tom Alterman, and as Molly said, I'm the Head of Product here at Notable. And my background is more on the technological side. I've been using AI products and great design to try and solve some of the biggest problems in the world and make these technologies really impact everyday lives.
So a quick overview of our agenda for the webinar today. So first, I'm going to touch a little bit on administrative creep that has spread through healthcare. Then how digitization, including the legacy chatbot, have not yet provided the needed relief. We'll talk about some of the limitations that legacy chatbots have that have prevented them from really moving the needle on reducing administrative burden. And then we'll close by sharing how conversational AI is fundamentally transforming chat experiences and also how patients engage with their care. So before we talk about chatbots versus conversational AI, I want to take a step back and ground us here. Why are digital tools needed? What problems are we facing as an industry? So I want you to take a moment and think about the last interaction that you or your family had with the healthcare system. It might have been getting a medical appointment, trying to get a medication, or getting diagnostic tests. The chances are that as you tried to do that, you felt more friction, more barriers than you did 10 years ago. You might have felt frustrated. You might have found the interaction to be impersonal. And if you did, you're not alone. As our health system has gotten more and more complex, there's been this administrative creep with seemingly ever more middlemen in between you and the care that you're hoping to get for you and your family. And the data back this up. There's an astonishing statistic. Between 1975 and 2010, the number of physicians in the United States grew by 150%. At the same time, the number of healthcare administrators increased 3,200%. And this seems to be a uniquely American problem. Administrative costs comprise a larger share of healthcare spending in the United States than in any other high-income country. And so this is what you're feeling when you try to get healthcare. And for those of us who work in care delivery, this is what we feel in our daily jobs as we're trying to provide care to patients and families. From clinicians to our front desk staff, every person involved with care delivery feels this growing amount of friction, administrative overhead, and the manual repetitive tasks within our daily workflows. And we've seen this get even worse these last few years in care delivery organizations through the COVID pandemic, and then worsen again with the labor challenges in the current macroeconomic environment. Everyone is feeling the effects of this burden more and more acutely. And today, no provider is immune from these impacts. First, labor shortages are impacting both clinical and non-clinical roles. It's increasingly difficult to attract and retain medical assistants, call center staff, patient service representatives. There are higher paying, less stressful jobs available at places like Target, Starbucks, McDonald's. The second is severe margin pressures. Running a hospital or health system has always been challenging, But in 2020 and 2022, we had unique years. These were the only years in recent history where the majority of hospitals posted negative financial margins. And third, the administrative burden is harming patients. This recent study revealed that a quarter of adults have experienced delayed or missed care because of this. Playing phone tag with a provider's office isn't just frustrating or annoying. It can compromise a patient's treatment plan. Now, these challenges are probably familiar to most of you on the call. In my previous role working at UCSF in digital health, we focused a lot of energy and resources in trying to address these challenges. Now, there's been an enormous amount of investment in health IT over the past few decades in the US. Since 2011, a majority of health systems in the country have adopted electronic health records and accompanying digital tools. And yet, the number of full-time employees required to support patient care, and this graph here on the right is essentially number of employees per 1,000 admissions in the US, it's remained stagnant. So we haven't reduced the amount of effort it takes to provide care to patients in this country. And whereas in most other industries, technology adoption ushers in a new era of efficiency, of better experience, of improved value, in most parts of healthcare, we just haven't experienced those gains yet. So let's talk about the chatbot as an example of this. So chatbots were introduced with the theory that they'd be a digital engagement tool that could improve experience and save administrative time. Instead, we've seen them increase the amount of work for staff and for IT, as well as causing anything ranging from bewilderment to frustration for patients. Now, one key reason for this, the fundamental limitations of the technology that they're built from. So I'm going to hand it over to my colleague, Tom, to explain some of those limitations.
Thank you, Dr. Nycene. As mentioned, chatbots have been tried for a while because we can see the opportunity here to reduce the administrative burden on both clinicians and admin staff alike. However, due to the fundamental technology on top of which they're built, they fail to deliver on those opportunities and actually drive the outcomes and value we're looking for. And this is true both in and outside of healthcare. Now, I'm sure we've all interacted with these as we go around the internet. And I'm sure we probably just subconsciously ignore them or minimize them because we all have the same expectation. They are not going to actually help me get the thing I'm trying to do done. They are underwhelming and cause more frustration because they're just limited in what they can currently respond with and help you with. And here are some examples of these from retail, airlines, and entertainment. We are trained to simply ignore those chatbots and just move ahead with trying to get those problems solved in different ways. And unfortunately, healthcare is no different. Here are two examples of health system websites. The challenge here is that either they're programmed to do a thing that you don't want to do, and therefore they just have to connect you to a virtual assistant who really just slowing you down from actually speaking to someone and getting it done, or they're not able to understand what you're trying to say in the intent of what you're saying. And that's because these legacy chatbots rely on decision trees and limited information. Much like how you design a website or an app, you have to, ahead of time, try and predict what are people trying to say, how are they going to say it, and therefore what paths can you build out and maintain to make sure that you guide people to the right place. This means that IT or admin staff must map out every possible use case and prompt or even need to point them at those respective answers. And they're also limited about how much they can understand what a patient's trying to say. Usually, unless they phrase it in the exact way they're expecting, it will not understand what they're doing, let alone if that person tries to use a different language or may not be clear on what the medical terms are. And we know that in our industry, there's a huge amount of terminology that is never that clear to patients. The other part here is we can only offer templated responses that must be manually maintained. So as information changes or context changes, they lack the nuance necessary to answer those unique questions. And most of the questions that customers have are really around those weird, unique things that aren't obvious on the website. Where do I park for my cardiology appointment? Unfortunately, these limitations only hold back health teams from delivering the care the patients need when they need it. I'm going to hand it back to Dr. Neinstein to explain what this truly means for health systems and patients.
Thanks, Tom. So the technical limitations of chatbots really do lead to barriers in patient access to care. Because chatbots fail to resolve most patient needs, they fail to alleviate pressure on the call center. And this increasing over-reliance on the call center drives higher operational costs and inhibits patient access, further exacerbating this existing challenge of administrative overload. Now, call center staff can schedule up to about 4 to 5 patients an hour. Patients are spending 8 minutes or more than 8 minutes on the phone to get the care they need, and 60% of patients will hang up and potentially defer care within 60 seconds of being put on hold. Additionally, call centers can create more barriers with accessibility given the limitations of languages available. And so while it's great to see many health systems investing in optimizing their call centers to help alleviate patient access challenges, at the same time, continuing to add more and more call center agents may not be a financially scalable or a sustainable solution. And so we've got to get to a place where we have improved self-service options for patients. So I'm going to hand it back over to Tom to share more about what the next generation of conversational experiences looks like for healthcare.
Thank you, Dr. Neinstein. Whenever I approach a new problem area or try and build products, I tend to start with, what does a magical experience look like? And so I always ask myself with this, what is the magical experience that someone would have when they're trying to navigate the complex world of healthcare? And I think back to what were the best experiences whenever I had to deal with that. And I'd like you to think about that too. It was probably speaking to a staff member who is incredibly experienced, incredibly empathetic, was there for you for whatever question you had. They were able to speak in your language, respond in to the level of clarity that you needed, and were just there for you no matter what you needed to do, and also just knew who you were, who to speak to, how to get that thing done, and were available for you whenever you needed them. Luckily, we're not that far away from that vision. In fact, we're very close to it. And this is the real unlock in conversational AI and large language models. This technology has the ability to provide that experience to everyone infinitely wherever they are in a more accessible, intuitive, and personalized way than we've ever been able to manage it. And this is really key because large language models are already an advancement that we didn't think was going to be possible for more than for at least another decade. And that's because they are trained on data sets to understand language patterns, context, and intent. They can take the messiness of human communication and turn that into structure that then can be used to take actions. Also, much like a great staff member, they learn from the interactions and constantly add to the results of those interactions to build up that internal knowledge base without you having to be explicit about every single item they must know. And because they can understand the prompts and intents, it can trigger workflows to complete tasks or requests. Oh, it looks like you want to pay a bill, or you have a question about financial assistance. Let me point you in the right direction. But side by side, the underlying technology behind the legacy chatbot and the conversational AI are completely different. And this is really where we talk about LLM-powered conversation or large language model-powered conversation through a chat interface and how it's considerably more powerful than legacy chatbots. And that's because chatbots are text-based, reliant on predetermined flows, and require significant resourcing to build and maintain. The analogy here is that really a chatbot is just another way of building a website or an app or a automated voice response system when you call a phone number. An LLM-powered chat interface is more like interacting with a real human being, working through voice and text, powered by natural language processing and understanding and empathy, and is easily deployable, and you're able to continually optimize. The key with that is you optimize it in the same way that you would train a great staff member or call center agent, and give them more context, more feedback, more coaching, rather than have to write out explicit instructions or maintain the data set that they use. So I'd like to share a little bit more about how large language models and conversational AI are significantly more powerful in this context. And I'm going to use two use cases. That first one of answering patient questions, and then also actually resolving a task. And in this instance, they'll be scheduling. So for general patient Q&A, what conversational AI provides is the most optimal answer in terms of accuracy, clarity, and brevity for any question. And what it does is it ingests a large amount of structured and unstructured information from multiple sources using databases or document stores or wherever that information is found. Using the analogy again of the world's best call center agent. They've read every single line and memorized every single line of your website. They've looked through all of your frequently asked questions and manuals and wikis. They know how to interact with the EHR. Then when you ask them a question, they understand what they're saying, they understand the intent, and then can lean on all that knowledge to figure out the right and most relevant information based on that query. And then critically, they can synthesize that back and respond in a way that's easy to digest for a patient and react to any follow-up questions or questions of clarity to try and change whether it's the tone of voice or the level of language to make sure that's truly understood. And through this methodology, conversational AI tools don't need to be trained on every single script or have to be decided upfront exactly how it's going to respond to every single question. It's just a context of giving them, hey, here's the information, here's the tone, and here are the rules you should follow, again, as you would coach a really good customer service agent. Next, we want to talk about how we train that agent or large language model to resolve requests or tasks. So through large language models, conversational AI tools can convert that natural language prompts into actionable workflows. This includes anything from scheduling an appointment or paying a bill. And how this happens is that the large language model acts as an interpreter to the other systems who can actually go and do that work. So they ingest the patient query and understand, oh, this person wants to change their appointment. It's an appointment with this doctor, and that's currently on the 28th. So it can understand that structure and make an API call with that specific information from the EHR and operate work with your system and hand that off to the API who can actually give back that information. Then it receives that information back from the API with new available time slots for that doctor and can share that back to the patient in a way that works best. And if the patient says, none of these work for me, what else do you have? They can go back and interact with that EHR, again, as a call center agent who has a really great knowledge of how to interact with those systems in a trustworthy and secure way. This is the critical thing, that the large language model isn't doing the decision-making here. The large language model is just interpreting what the customer is trying to say and then hands it off to your systems, your business logic to make the actions actually happen in the EHR. And this is where we have a greatest potential in tackling that administrative burden in healthcare and driving better outcomes. Because really what we've been able to do is fundamentally make what's really currently incredibly difficult for computers, which is understanding humans and communicating with them, and connect it to what computers can do incredibly well, which is handle a lot of the workflows and administrative tasks that go into patient scheduling, payments, prescription refills, appointment management, all automated into this digital self-serve experience for patients. Not only does this technology allow us to tackle the admin burden, but it also enables health systems to attract and acquire new patients, increase collections, and ensure that patients never need to talk to a live agent and have to wait for that to get their needs met. And as you've seen when searching for a chat tool, it's important to understand the nuances between chatbots and conversational AI. The difference between these is substantial. So when you're evaluating vendors for these kind of experiences, especially ones who are talking about conversational AI, here are a few things that I recommend that you really dig into. Firstly, you want to understand the underlying technology. What is it and how is it powering the experience? Secondly, you want to understand the technical lift to implement and maintain that solution. What ongoing costs are there? What do you have to hard code? What do you not? And how much do you get to control it? And that's this really critical point number 3, is you want to know how can you coach that conversational AI to deliver the experiences you want and critically mitigate what we call hallucinations. And this is a very important point because the way large language models work is they can seem human and seem like they know what they're talking about, but ultimately these are probability engines. They take everything that they know and come up with the next most likely word that they should say. And if it's not trained correctly, and if there's not the right amount of controls, it can do what we call a hallucination, where it just invents a language based on what it knows to answer the question. And this is, of course, a very bad experience anywhere, but critically something that we never want to happen in the world of healthcare. Fourthly, you want to ensure that it can do more than just answer questions. You want it to connect to those patient workflows and help them get the things that they need done. And lastly, you want to ensure that it enables greater accessibility through supporting multiple languages, through voice, text, making sure it's accessible to your entire patient population. So choosing the right partner with the right approach is critical in utilizing the power of large language models and conversational AI correctly. So lastly, I'll just want to call out that if you're looking for a conversational AI partner with proven results, check out Notable. We've released an assistant focused on trying to tackle all of these things and deliver that magical experience I was talking about before. How can we create a concierge-level experience for every patient without causing any extra work for staff? And this is how we're leveraging the advancements in AI and combining it with what is already possible in the Notable platform, and focusing on the increase in patient expectations and the increase in competition for patients, allowing us to completely power it using large language models, allowing it to support 130 languages, understand any tone, any dialect, and respond with human-like intelligence. Make sure it's integrated with your EHR, enabling you to power end-to-end patient workflows, and is able to be set up and trained on your website assets and content within days with minimal IT resources through our internal no-code platform. So if you'd like to see more about what this looks like for your health system, please reach out and see after this webinar, or leave a note in the survey. We'd be more than happy to connect with you. Thank you so much for your time, and I believe we're opening it up to some questions now.
Thank you, Dr. Neinstein and Tom, for a great presentation. We have time for a few audience questions now. And the first question we have here is around clinical applications of this tool. Specifically, the audience member is asking, are there any clinical applications of this tool and how would providers use it?
Yeah, I can take that one. That's a great question. So we believe there's so much value to unlock in first tackling the administrative burdens that we're facing. So we focused our initial development of Assistant on doing just that. We've heard this from the health systems that we work with when we talk to them about the top reasons that they're having high volumes of patient phone calls. These were the areas they cited, and the data backed this up. Bain surveyed almost 100 healthcare executives about the top reasons of focus and the top areas of focus that they were looking for out of generative AI. And they identified opportunities to reduce administrative burdens, to enhance operational efficiency. And so, although we don't support clinical triage at this time, they are use cases that we're considering, we're exploring, and we want to do it with the proper safety and efficacy, as well as learning from our partners whether that's a high priority for them. And the bar for clinical decision support is appropriately much higher. And before we get there, there's so much opportunity to benefit patients, families, care teams from just reducing the friction and the barriers that they face to care. And so we're so excited to make progress in those areas first as important contributors to improving patient access, experience, and outcomes.
Great. Thanks so much for walking us through that. This next question here is an important question around PHI. How do you ensure that PHI is not used in training these models?
Yes, absolutely. That's a really important aspect here. And we wouldn't have even considered doing this if we weren't 100% confident that we could use large language models that met our stringent data security standards. And really for us, that's 4 things. Firstly, making sure it's HIPAA compliant. Secondly, is making sure these queries are never used for training data, that history is only stored for purposes of security and abuse monitoring, but otherwise that doesn't stay in the system. Also, obviously, having all of the maintenance of security certifications, so things like SOC 2, high trust, and lastly, and very importantly, great data encryption, whether it's in transit and at rest, making sure that it's at least as good, if not better, than any other system that patients interact with.
Great. Thanks so much, Tom. And Tom, I think we'll stick with you for this last question here. This audience member is asking, how do you get the LLM to answer a specific question in the way that I want without having to hard code it in?
Yes, I'll go back to the analogy I had earlier around coaching a fantastic customer service agent, where rather than going in and hard coding things in the UI, you can effectively write a document with that coaching in it written in natural language. So guiding to, if patients ask about these kind of things, you should respond in this way, or try this particular answer if someone has a question about this. And the key thing there is that you can keep it in that natural language and not have to actually give every single answer to a specific question. That's how we implemented it, that effectively you have a platform in our system called Flow Studio, and that you are able to configure, customize, and deploy it without any handholding from us. You can write that document, upload it, see how it responds to those questions after that, and then continually give it more coaching as needed. And if you have a particular thing where in certain circumstances, it must always say that, again, just like a great agent, you can tell it that. You can say, use this exact language in this scenario, because it's really, really important that we get that right.
Wonderful. Thanks so much for walking us through that, Tom. Great analogy. With that, it is all the time we have for today. I want to thank Dr. Neinstein and Tom again for sharing their time and insights today. And I also want to thank Notable for sponsoring today's content. And to our audience, thank you so much for joining us. Please take a moment and fill out the post-webinar survey and have a wonderful rest of your day.